to another episode of Inside the Lab. I'm Krishna Sharma and we're here with Alpesh Doshi, consultant embryologist at IVF London. Today we're going to be talking about pre-implantation genetic screening. Hi Alpesh, how are you?
Hi Krishna, I'm very well. How are you?
Very well, thank you. So first, before we get into what PGS is, I want to talk about what are chromosomes and what is euploidy and aneuploidy, just for audience members who might not know.
Sure. Euploidy and aneuploidy is something we'll go in a bit later, but what are chromosomes? Chromosomes are nothing but a package of DNA material that we all carry, condensed into structures which are called chromosomes. So a chromosome has a lot of DNA that arises from both the mother, the father, and of course the embryo as well. So typically any individual, me and you, both of us, we would have 46 chromosomes, or what we call 23 pairs of chromosomes. Females have got 22 autosomes and 1 pair of sex chromosomes, and same for men as well. Females are XX in their sex chromosomes and males are XY in the sex chromosomes. So typically we all have 23 pairs of chromosomes. That makes a normal set of chromosomes. Your next question was what is euploidy and what is aneuploidy. So the term euploidy stands for a normal set of full 46 chromosomes. Okay? And the word aneuploidy means when there is a chromosome or multiple chromosomes missing or that are extra in cells.
And so what sort of conditions can an aneuploidy cause?
Again, very good question. So we know for a fact that in IVF, one of the main reasons why IVF doesn't work or it fails or even the embryo miscarries is chromosomal abnormalities or aneuploidy per se. So these aneuploidies can be of any chromosome, but typically aneuploidies that lead to what we call miscarriages or even sometimes live births, but the embryo or the baby is chromosomally abnormal. So such cases, which are what we call the viable trisomies, are chromosome 21, mostly referred to as Down syndrome, chromosome 18, chromosome 13, which is Edwards and Patau syndrome. And when there is a problem with the sex chromosomes, as I mentioned earlier, the XX and XY, in men, one such condition could be Klinefelter syndrome, whereby there is an extra X chromosome. And in women, it could be XO or Turner syndrome. So these are the chromosomal disorders or abnormalities that can persist almost up to live birth as well.
Okay, and so pre-implantation genetic screening, PGS, can check for these aneuploidies?
That's correct.
How does that work?
So science is fascinating and I think embryology is beautiful. One of the developments in many recent years has been how to test embryos for these chromosomal disorders or chromosomal abnormalities. All in the pursuit to improve pregnancy rate, lower miscarriage rate and potentially increase live birth rates. Because we know, as I said earlier, that typically in women over the age of 38, almost half of their embryos can be chromosomally abnormal. So an embryo may look beautiful, Krishna, in the laboratory. However, if chromosomally it is abnormal, it will not implant. And if it implants, it may lead to a miscarriage.
Right. And there's a certain method used for PGS, and some people fear that it may put their embryos at risk.
Sure. So the way PGS is carried out, we are still in an era whereby it is an invasive procedure. So like, when we're diagnosing any cancers, as you know, you have to take a biopsy of the tissue. Okay? With PGS as well, we have to take a biopsy of the embryo. So you grow the embryo for 5 days or 6 days up to blastocyst. Take a small biopsy at the blastocyst stage of typically 5 to 7 cells, and this is where potentially the damage can happen if performed by an embryologist who is not skilled at the procedure. But if performed in a very skillful manner by an experienced embryologist, a small biopsy can be taken and these cells can then be tested for genetic abnormalities such as chromosomal disorders.
And so you've already mentioned women over the age of 38. Is there anyone else you'd recommend PGS for?
So age is a very common reason why PGS can be applied. Women who've had repeated implantation failure, so women who've gone through 2 or 3 cycles of IVF, had good quality embryos but no implantation or no pregnancy, that's another category of patients that can benefit from PGS. And most importantly, women who've had miscarriages in the past who don't want to go through the whole miscarriage again, and to optimize pregnancy and live birth.
That's very interesting, and it's incredible where science is taking us nowadays.
Absolutely.
Thank you so much for
Thank
answering
you.
my questions. We'll see you next time on another episode of Inside the Lab.
And again, if you have any questions, you can reach us on info@ivflondon.co.uk or email us. Our website is ivflondon.co.uk, or connect with us through our social media platforms.